There are some women who opt to have both breasts removed, what's called a bilateral mastectomy. They may have cancer in one breast and they're opting to have a mastectomy, or they need to have a mastectomy there, and then they choose to do what's called a prophylactic mastectomy, removing the other breast that does not have a known cancer. They're doing it to decrease the risk of developing breast cancer. Women may choose that for a whole variety of reasons, but every choice that we make in life is really determined by our prior life experience. So for women who make that decision, it's the right decision for them. What my job as their breast surgeon is to make sure that that's an educated decision and that it's a well thought out and not driven completely by fear. We can't remove the fear aspect of this. It's just impossible to do, but we can decrease that. And in fact, in my practice, what I do is we have at Beth Israel a division of cancer supportive services. And what I do is for any woman who is electing to have a bilateral mastectomy, either by choice or because she needs it based on the cancer, that they actually speak to the head of our cancer supportive services to make sure that the fear is not the only driving force in this, and that she's thought through all of these options and the reasons for it. And the reason why I do that is because there are times where it's difficult to have that discussion with your treating surgeon, that I may not think of all of the emotional or the sexual aspects of that. So it's someone really removed from their care having this decision. And I can tell you that most women are very grateful for that because it's brought up some aspects of it that they hadn't thought of. The interesting thing is very, very few women change their mind after that, but it brings to their focus some things that they had not previously thought about.